on. Now you're going to testify from the podium when I call you. Good evening. This is the hearing of the Health Committee of the Baltimore City Council. Tonight we are hearing a legislative oversight. It's for the purpose of updating events surrounding recent possible cases of measles in Baltimore City and elsewhere, educating on measles and other communicable diseases preventable by vaccination, and briefing the public on proper infection prevention and control protocol. I first want to say thank you to the Johns Hopkins Hospital System and the Good Samaritan Hospitals. Both hospitals were immensely helpful during the suspected measles case that was thankfully was not measles. But with what's going on around the country, and every evening on the news, you see maps of different states where there are outbreaks. And obviously the outbreak at Disney World, I believe, in California, sort of set off a little hysteria. So this evening we're having an oversight from the Health Committee, and we are having here Dr. Nguyen, Dr. Leanna Nguyen, the Health Commissioner, who was just recently, 24 hours ago, actually was officially sworn in as a Health Commissioner, Dr. Nguyen, so this will be one of your first duties as Health Commissioner to inform the Council, but also to inform the public of what's going on with the measles outbreak and what can we do in Baltimore City to prevent that. So Dr. Nguyen, introduce anyone you have with here this evening. This is a little less regiment. First of all, I'm joined by Councilman Pete Welsh to my immediate left. Pete is a member of the Health Committee. Councilwoman Rochelle Ricky Spector, the Dean of the Council, was with us tonight. I expect other council members will be here as traffic abates and they can get to City Hall. We'll also have the highly regarded staff member from Council Services to the Health Committee, DePaul Nibber, I call him by his first name, DePaul, named after a great university. They recently hired next few months, but he's well regarded as Council Services staff as committee. He doesn't want to sit next to me. I don't know why, but why don't you come over here? Up close and personal. I need my staff right next to me. Also joined by Ms. Kara Kuntz, who is the Legislative Director of Council President Bernard C. Jack Young, Ms. Angela Gibson, who is a liaison from Mayor Stephanie Lawrence Blake to the Baltimore City Council. And with that, Dr. Nguyen, introduce who is with you, and then we're going to go right into your testimony. So you can come to the podium.
Thank you. Good afternoon, or maybe it's good evening, Chairman Curran and members of the City Council, Councilwoman Ricky Spector, Councilman Welsh. Thank you for convening the Health Committee to discuss the important topic of childhood vaccinations. On behalf of the Baltimore City Health Department, I wish to thank you for inviting me to provide testimony on vaccine-preventable diseases and the Health Department's actions in response to the recent case of possible measles here in Baltimore City. This hearing comes at a critical time when a number of states around the country are experiencing a record number of measles cases. Before I begin, as you requested, Chairman Curran, I would like to introduce the members of our health department who are here today, as well as some of our guests. Shortly, you will be hearing testimony from Dr. Tina Kumra, who is a pediatrician locally in Baltimore City, as well as Ms. Kamala Alexander, who is a parent here in Baltimore City. I'm also pleased to introduce a number of people in our health department. I'm going to go around the circle and see. So Dr. Shelley True is a preventive medicine resident who has been rotating with us in the health department. Mary Grace White is the director of our acute communicable diseases and had played a critical leadership role in the possible measles case, as well as other communicable diseases in the area. We then have in the next row, or here actually, Andrew Nicholas, who is the Director of Legislative Affairs in the Health Department. We have Michael Schwartzberg, the Public Information Officer in our department. Shannon Mays Heller, the Director of the Office of Policy and Planning. In the next row, then we have Shirley Tay, the Executive Assistant to the Commissioner, who has been instrumental in helping us to coordinate many of our activities. We have Dr. Jonay Caldoun, who is an emergency physician at the University of Maryland, and also is our newly appointed Chief Medical Officer at the Health Department, also instrumental in her leadership. Don O'Neill, one of our deputies in the Health Department, who has a lot of experience in health insurance as well as in public health. Well, we have Rihanna Matthews-Brown, our also recently appointed Chief of Staff, who is with us as well. And Dr. Patrick Chalk, I see, just walked in, who is the Assistant Commissioner for HIV and STIs, also has played a critical role as one of our doctors in the health department too.
Thank you for bringing those folks with you.
Absolutely, and I'm grateful that they're all here to speak about this really important issue. So we are fortunate that the recent suspected case of measles here in Baltimore was determined, in fact, not to be measles. But this case has highlighted an important issue that demands all of our attention. And I'm grateful for your leadership today in calling for this hearing, Chairman Curran. It's a reminder that Baltimore is not an island. And even though we have not yet had a confirmed case of measles here, that this could really happen to us at any time. And this is something that all of us should learn about. So I'd like to start today by providing a few facts about measles, which is one of the most contagious viruses in the world. Measles is so contagious that 90% of people who come into contact with someone with measles will get it unless they're vaccinated. One person with measles will spread it to an average of 18 to 20 unvaccinated individuals. Like the flu and the common cold, measles is spread by coughing, sneezing, and direct contact with contaminated surfaces such as money or doorknob or other surfaces. Symptoms of measles include a high fever, a rash with little red spots that often begins at the hairline spreading downward, runny nose, red eyes, and cough. There are many complications of measles that include pneumonia and brain swelling that can lead to hearing loss, permanent brain damage, and even death. Anyone can get measles. As the recent case of measles outbreak has illustrated, there have been individuals affected who are infants, several months old, to elderly individuals over 65 as well. Prior to the invention of the measles vaccine in the 1960s, nearly every school-age child contracted measles. We're talking millions of people got infected with measles every year. Hundreds of people died from measles, and thousands suffered permanent brain damage. In the 1930s, there was a measles outbreak right here in Baltimore that sickened and killed hundreds of our children. There was fear and uncertainty and anxiety that reigned over our city. Thankfully, a measles vaccine was developed in the 1960s that was so effective that by the year 2000, measles was considered to be eliminated in the United States. Now, vaccines work by protecting the individual, usually the child, against the disease. There's also something called community immunity or herd immunity. That is when about 95% of the population is vaccinated against a disease. This prevents the disease from spreading, and in particular helps those who are unable to get vaccinated, such as infants under a year old and those with weakened immune systems. Unfortunately, as you all know, and as our chairman alluded to, measles is making a comeback in the US. This is due to parents receiving misinformation and choosing not to vaccinate their children. In 2000, there were virtually no cases of measles in the United States. In 2014, there were 644 cases in 27 states. This year, as you know, there has been an outbreak of measles that is thought to have originated in California at Disneyland, the happiest place on earth. And now, to date, more than 100 people are infected in 15 states, including California, Arizona, Washington, and Nebraska. And we heard today that there is one confirmed case of measles in the District of Columbia, not far from where we are here in Baltimore City. Now, we're fortunate that Baltimore City has not had a case of measles in at least a decade. That is because of our very high vaccination rates and the leadership of our esteemed leaders who have ensured that that's the case. 99% of our public school children are vaccinated here in Baltimore City. Now, 2 weeks ago, we in the health department have investigated a possible case of measles in a 1-year-old girl. This child presented with measles-like symptoms to 2 local hospitals that our chairman talked about, and specifically went to the emergency departments of these hospitals on Wednesday, January 21st. In the hospital, the child had blood work and nasal swabs done that tested positive for the measles virus. Our doctors and epidemiologists worked around the clock to investigate this case. We found that this patient had no travel history, including internationally into areas that in the affected states. She had no exposure to people who are ill. We also found that about 2 weeks prior, this patient received the MMR vaccine, or the measles, mumps, and rubella vaccine. According to the CDC, the Centers for Disease Control, about 5% of people who receive the MMR vaccine develop a fever and a rash. That's a totally safe reaction that resolves on its own and is not measles. Based on what we knew about this case, we suspected that this child did not have measles, but rather had a reaction to the vaccine. However, the only way to determine if this patient had measles or had a reaction to the vaccine was to do a special test to genotype or figure out the genetic code of the measles virus found in this patient. This test was a specialized test that had to be conducted by the CDC in Atlanta, and the soonest that those results would be available was Wednesday, January 28th, or Thursday, the 29th, which was a full week after the child was diagnosed in the first place. Given how contagious measles is, and given the outbreak going on around the country, we acted out of an abundance of caution to take every precaution to protect Baltimore. We discussed the case multiple times a day with state and federal officials at the CDC, at the Maryland Department of Health and Mental Hygiene, and we followed their joint recommendations, which included the following 3 precautions. First, the patient was placed in isolation at home following discharge from the hospital on that day of January 21st. Measles is infectious from 4 days before to 4 days after the start of the rash. So the patient was placed in isolation until January the 25th. Second, our doctors and epidemiologists implemented contact tracing measures to identify all possible patient contacts during the 8-day infectious period to make sure that they were protected. Third, we worked closely with the involved hospitals to implement infection control protocols to identify and alert potentially affected patients and staff. And as Chairman Curran mentioned, our partners at Good Samaritan Hospital and Johns Hopkins were excellent partners who worked with us day and night to protect their staff and patients and visitors. On Thursday, January 29th, as promised, we received the excellent news from the CDC that the laboratory testing result was back, and this Baltimore child did not have measles. She has recovered well, and there are no other cases in Baltimore City that we are aware of. Now, we're very glad that this child is doing well, and that this, in fact, was not measles here in Baltimore. However, given the outbreak around the country, the fact that it's spreading as far from Disney as to DC and Pennsylvania and in the East Coast, we want to remind everyone that Baltimore is not an island. This is a wake-up call. I cannot emphasize enough the importance of childhood vaccinations. That is the only way to ensure that our children are protected from measles and other life-threatening diseases. I urge for everyone to take this opportunity to make sure that your children are immunized. Getting children immunized against all types of preventable diseases protects not only that child, but also protects everyone around them. Vaccines are safe, they're effective, and they save lives every single day. The health department's TIKE, which stands for To Immunize Kids Everywhere clinic, provides free vaccinations for children who are uninsured or underinsured. On Tuesdays and Thursdays, vaccinations are available between 10 a.m. and 1 p.m. at the Eastern Health District, which is located at 620 North Caroline Street, and also on Wednesdays between 10 a.m. and 1 p.m. at Droid Health Center, which is 1515 West North Avenue. To conclude, I wish to thank Chairman Curran and the members of the City Council for allowing us to provide testimony on this critical topic. Our staff at the Baltimore City Health Department are 100% committed to protecting the public and serving Baltimore. I'm happy to answer any questions that you may have. Thank you.
Dr. Nguyen. I want to mention that we are joined by another member of the Health Committee, Councilman Eric Costello from the 11th District. I have a few questions. And I hate to say this, but the only stupid question is the one that you don't ask. Is measles only a childhood issue? Or can someone who has never had measles, never been vaccinated, a mid-aged adult or a young adult or even our senior population, older adults, can they contact someone that has measles and catch the illness?
That's an excellent question, Councilman Curran, and you're absolutely right that this is not a stupid question at all. In fact, it's
Right.
an excellent one. The reason why we think of measles inaccurately as a childhood disease is back before there were vaccinations, people all got measles as children. They didn't go past their school age before they contracted measles, which is why we think of measles, along with mumps and rubella and so many of the other things, as childhood diseases. But actually, anyone at any time can contract measles. And we've seen this in the case of Disneyland, that there are children under the age of 1 who have contracted measles. Again, these are children who are unable to get immunized. So these children depend on all of us to protect them from getting measles. And we've seen this in the elderly as well. I believe that the oldest person so far in this outbreak to have gotten measles is 70 years old. So absolutely, measles can affect anyone of any age, and we in particular have a duty to protect those in our community who are unable to get vaccinated, which sometimes would include elderly and people of various ages who have compromised immune systems, which means, for example, patients who are recipients of organ transplants, who are cancer patients on chemotherapy, who have HIV/AIDS and other immune compromises.
They would be more susceptible to a contact with somebody that has measles and would be more susceptible to catch the illness.
Very much so, that they have weakened immune systems as it is, and also many of these individuals are unable to receive the vaccine to properly protect them, which is why we as a society, we as a community must do our part to protect these individuals.
Now, you mentioned that a individual has measles. There's a 90% chance of spreading that illness to another person that can be susceptible to it.
That's right.
Just
That's right.
So if it was any sort of outbreak, it would spread quickly if the folks were not vaccinated against it. Now, a vaccination in a young child lasts forever, in a sense. You're always, because I don't recall. I know I had chicken pox. I guess I had measles. It's half century ago, so I'm a little foggy on my personal history. But I'm sure as growing up, we always had those normal diseases that kids get in grade school. And I know that at Blessed Sacrament, when there was always concerns, when one child had an issue, then the other parents would say, well, keep my kid out of school, or keep that kid out of school so they won't spread the measles or chicken pox or other childhood illnesses that we had a half century ago. Is that still goes for now? If a child's in a classroom, possible measles, even though the one we had that you tested was not, would there be some sort of hysteria? This town, and I hate to say this, but I guess it was everywhere. Everyone was recently all tuned to the Ebola virus that went worldwide. I guess the internet and everything, and the social media spreads everything out. But 7, 8, 9 years ago, we had the West Nile virus that were some affected birds or might be affecting humans, and it came a front page issue in this town, and we had to do our spraying and make sure that we don't allow any water to accumulate. Will this measles would it become a hysteria such as the Ebola or the West Nile virus if it starts to spread? Is that do you fear as a public health official that we need to calm the public, let the public be educated what's going on, so that the hysteria surrounding misinformation, because you mentioned about misinformation that parents are receiving about vaccinations. I depend on, and I hope that most of my colleagues in City Council depend on our health officials, our health commissioner, to give us the right information. What happens? What is the misinformation that is being distributed, and do you fear that that misinformation might lead to some sort of mini hysteria over this issue?
Thank you for raising some really important points, and I want to address them in order. I believe there were 4 points. The first is about how contagious measles is. You're absolutely right that measles is one of the most contagious diseases in the world. The 90% figure is even an underestimate. We think that more than 90% of people who come into contact with someone with measles will get it, which is a very high number, and the reason why measles is considered to be a harbinger of outbreaks, that if we're getting a measles outbreak, it's because it's so contagious. But that means that other outbreaks are possible as well. They're less contagious diseases, but measles may be only the start of other things, especially in communities where, fortunately, Baltimore is not one of them, but there are communities where 50% of, or 10% even, or 20% of people are not vaccinated. So you're right that it is very much a disease that is easily contagious. The second point you raised was about hysteria, and specifically about the hysteria that the public may get when it comes to, oh, maybe I have a fever, maybe I feel like I have a cough, maybe I have measles. That is not the impression that I want people to take away from the outbreaks at all. Rather, I, as a public health official and in the health department, we want our citizens to know that we are already a city that protects our citizens very well. With an over 99% vaccination rate in our school children, we are doing very well as a city to protect ourselves and protect our communities. But what we do want people to know is that this is not time to be complacent, that we need to make sure that we dispel misinformation, that we address any myths that may come up, and that we really base our decisions on evidence and on science, and not on myths that we may be hearing from various other irreputable sources. And so the key is not to spread hysteria, but rather to use this opportunity to say, let's make sure that everyone is vaccinated. Another point, excellent point that you raised, Councilman Curran, is related to how long the measles vaccine will last, and so I want to address this as well. Prior to 1957, people who were born before 1957, it is presumed that they all are immune to measles because virtually everybody born before that period had measles as a child. And so for people who were born before 1957, we presume that they are immune to measles by virtue of having had it in the past. Also, if you've had 2 doses of the MMR vaccine, the measles, mumps, and rubella vaccine, we consider you to be immune from receiving measles as well. If, however, you're not sure if you've had the 2 doses, or perhaps you were born in another country and we're not sure if perhaps you had measles as a child, you don't remember, then there is a way to find out, which is to get your blood titers checked. And your doctor can check your blood titers and find out if you are, in fact, immune to measles. If you're not immune, you can always get a booster shot. The fourth point that you mentioned, and I also think was a really excellent reminder for all of us, is that there are many sources of misinformation out there. And those of us in public health, those of us in medicine, those of us in science, it is our duty, and also the duty of our leaders around our city, to remind people that you cannot choose cafeteria-style science. That if there are scientific facts and papers and research that's been done over and over again, that has been, if something has been proven, then those are the facts that we have to go by, that we do not go by the quote-unquote facts that are disseminated by Hollywood celebrities, because that is not the best way to get information. And so it is for this reason that we're particularly thankful to have you convene this hearing, so that we will be able to inform our community about the facts and not the myths surrounding measles.
Dr. Nguyen, before I recognize my colleagues that have questions, you have a fact sheet here on measles. Can this be accessed through the website at the Baltimore City Health Department?
Very much. Thank you for mentioning this. And we also have copies of the fact sheet today available to everyone in attendance. And our website at the Baltimore City Health Department contains other information, not just about measles, but also about other public health crises, other public health issues that are facing our city.
Can also the number here at the Baltimore City Health Department immunization program, the 410-396-4454, folks can get information on how to get their vaccinations?
Absolutely. We have plenty of vaccinations, and we encourage everyone to protect themselves and protect their communities. And
you do have 2 centers around the city that will distribute these for free?
To children who are uninsured and underinsured. And every physician's office, we certainly recommend for all of our patients to go see their primary care doctors and ask more about vaccinations.
And one last question is, if you go to a doctor with your child or with whoever, does a doctor have to report that it was a case of measles to the health department?
Yes, measles is a reportable disease,
Okay.
and so every case of measles will be reported to us in the health department, and suspected cases of measles as well, which was the case in the child that we investigated.
Councilman Welsh.
Thank you, Mr. Chairman. Good evening, Dr. Nguyen. Happy to see you again. My question revolves around children and parents, and I looked at some information, some things that were going on in Ontario, and there appears to be an exemption that parents can have with their children receiving the measles vaccination. My question is two-part. Do we have that type of exemption in the state of Maryland, more specifically Baltimore City? And if we don't, how are parents held accountable for not giving their children or allowing their children to receive the measles vaccine?
That's an excellent question, and certainly one that's been in the news a lot recently as well, because many states do allow not only a religious exemption, but also a personal value exemption as well. For us, for the Baltimore City Public Schools, we do require that all of our children who are in K through 12 public schools, that they receive all their vaccinations, which would include the 2 doses of MMR. I do believe that we have a religious as well as a personal choice exemption in the state. I'm turning to my colleagues here to confirm that that's the case. We do have that in the state of Maryland. These exemptions are used infrequently. We had pulled some numbers earlier, and I believe it's in the order of about 1% or so of parents exercise those decisions. Of course, from my point of view as a public health official and as a physician, it is imperative that parents protect their children and also that we protect our communities. I believe that it's not only a matter of personal choice, but also of societal obligation. In the same way that we would see seatbelt use as something that is not just a matter of personal choice, but also we have a duty to protect those around us as well.
Okay. In the health department, do we have a special division set up or a contact person to deal with any reports of measles? And following up on that, do we have isolation procedures in place for those people who have come in contact with the virus?
I'm very glad that you asked this question, Councilman Welsh, and in fact, she's sitting right here in this room. So Mary Grace White is the director of our Acute Communicable Diseases office here in our health department, and she also has epidemiologists and doctors and other staff members who are trained for many years to specifically conduct the type of work that you're referring to, which includes contact tracing. In the case of the child in Baltimore City, what we did, for example, was to track down every place that this child was during their infectious period, which again was 4 days before to 4 days after the onset of the rash. And our epidemiologists and doctors during the past weekend also worked literally around the clock to be able to contact every person, whether it was staff and visitors and patients at the hospitals that this child was at, but also all their relatives and friends and anyone who may have come to their houses. This is the work of epidemiology, and we're glad to be able to share that with you to show how important public health is to Baltimore City.
Thank you, Dr. Nguyen.
Councilwoman Spector.
Mr. Chair, I want to compliment you on making this a speedy hearing because it's so timely, and I thank you, Dr. Nguyen, for participating and bringing your staff. I'm still not clear, so it's not mandatory that children that attend school be vaccinated? There's an option parents have?
There is around the country, especially when you look at, there are specific states that are where more parents opt out
Yes.
than others. Maryland, and especially here in Baltimore City, we're fortunate that our parents have listened to science and evidence and have chosen to vaccinate their children. In other parts of the country, we've gone, I believe our most recent numbers are.
Talking about, I'm concerned about Baltimore City. Can parents enroll their children in public schools and private schools if they have chosen not to vaccinate their children?
I believe the answer, I'm turning to my staff now, I believe the answer is yes. So we mandate that parents vaccinate their children prior to enrolling in public schools.
I understand the
However,
recommendation. I understand that, and I understand that we have the thread of it flaring up again because parents have chosen to, for fear that something down the road might cause their child. I think they were trying to connect it, and no matter how many reports we get and how much empirical information is out there, there are parents who still feel that there might be a link between autism and the vaccine. So I'm not clear. A parent who is afraid to give their child, to have their child vaccinated, that is not a problem if they want their child to go to public school or to enroll in any school? Is that the case?
There is an exemption that parents are allowed for personal choice and for religious objections.
Exemption doesn't require any qualifications. It's just, I chose not to have my child vaccinated.
That is correct, and that is also...
Yet, from a public health perspective, I can't understand it. I understand that you get a ticket if you travel with your, if you bring the baby home from the hospital, the baby has to be in a car seat. You can't, it's the law. What is the law? That's what I'm not clear on. Because a child in Disney infected kids from Mexico and California and Austria because they were at Disney and they were not immune to measles.
You're absolutely right, and this is the problem that we're seeing across the country that is now potentially could affect us here in Baltimore City, that around the country, our vaccination rates have dropped to something like 90 to 92%. And 95% is actually what public health leaders believe should be the magic number when it comes to herd immunity. And so we have gotten to this point because parents have decided based on, as you were saying, Councilwoman Spector, based on misinformation about vaccines. They have chosen a decision that's not only influencing their child, but actually potentially could influence other people around them.
So I'm telling you that my great-grandchild could go to school. He's 2 years old. He could go to daycare with other kids in daycare, and those parents have opted not to have their children vaccinated. So we're exposing our child to measles. That's what I don't... I mean, you know, I can see that there are still young people smoking. Now they're even smoking high-tech cigarettes. And everybody knows that's just definitely not a healthy thing to do. But this is so much more difficult for me to understand that that the parents aren't mandated to do this. That's what I can't understand.
And you're right. This is one of the reasons why I'm so thankful that we're having this hearing today, because we need to, because there is an exemption, we want to do our education.
What would it take for us to take that kind of action? That's what I want to know from a public health perspective.
If one were to change this exemption, I believe it would have to be a change in state law. And and again, in the meantime, while all these other discussions are happening, I, as a public health expert, as a scientist, as a doctor, am encouraging for all parents to make sure that their kids are vaccinated for exactly the reasons that you mentioned, Councilwoman, to protect ourselves and to protect everyone around us, because other people have not made that choice, right? And so you're exposing your child against their will. So,
Mr. Chair, I think a byproduct of this is something a little bit larger than just the good recommendation and the good information that we're getting from the doctor. I think we have to see if maybe it has reared enough of a fear in me that the exemption is just granted if you just choose not to do it, what you're exposing the public to. I think also that, is there a correlation between shingles? The infection of shingles is, if you have had measles, you can, chickenpox.
Right.
It's not measles, it's chickenpox.
Exactly. Shingles is a reactivation disease that is based on having previously having chickenpox.
Yeah.
And so shingles is, I could describe that in more detail, but I do not think that is our hearing.
That's the term.
But if there was a measles case identified, because whatever, would that household be quarantined as we were years ago when dinosaurs roamed the earth, that the health department would come out and quarantine the whole home?
That's an excellent question. What we would do in that case, and actually we were tested in this just 2 weeks ago when we had this possible slash suspected case of measles, what we do is the following. So the first is we isolate the child or the person, the person who is suspected of having measles so that they are not able to further infect or potentially infect other people who come into contact with them during that infectious period of 4 days before to 4 days after the onset of the rash. And then we explore and investigate all the contacts that they have been in contact with. And so, if let's say, and this was the case with the family in our situation as well, that if they all have received their MMR vaccine or have otherwise documentation that they are immune to measles, then they do not have to be isolated themselves because they are not going to be getting measles. However, if there were individuals who are either susceptible to measles as a result of not having had the vaccine, or if they are immunocompromised, where their immune systems are weakened, then we take additional measures to protect both them and also the public.
And is it true? I mean, some of the results are long-term medical problems if you have survived measles, if you have been exposed to them and have endured measles, that there are terrific health problems as a result of it?
Yes, and I'll give you some numbers to illustrate this. Back before the measles vaccine, there were millions of people who were infected with measles every year, on the order of 3 to 4 million people who were infected with measles. Several hundred people, on the order of 400 to 500 people, died from measles, including many here in Baltimore City. In addition, about 4,000 individuals would get something called encephalitis, which is swelling on the brain. And approximately 1 in 10 children would suffer permanent consequences, including hearing loss, brain damage, vision loss, and complications of pneumonia. So we are talking extreme consequences from having measles. It's not just this rash and fever, which people can get over, but rather it's the long-term consequences, including death, that often can happen. And this is another reason why we are so gravely concerned about the possibility of measles and other vaccine-preventable diseases returning, because we don't want this to affect our citizens again.
Dr. Wen, I mean, we have suffered so much economically, not anywhere near the public tragedy of lead paint poisoning in Baltimore City. I liken this to the same threat, the threat of measles coming back being just as serious.
Very much so. We also agree that another reason why we're so thankful that so many members of our city leadership are concerned about this issue, and certainly it's something that Mayor Rawlings Blake has also taken leadership of as well, to make sure that we protect and safeguard the interests of our citizens.
Well, as the City Council representative to the Maryland Association of Counties, we lobby the legislature, so to speak, for legislation that affects local government. And I'm going to bring this to next Wednesday's meeting, Mr. Chair, to see if we can encourage maybe a statewide bill that would go in terms of making the inoculation, making it mandatory.
Thank you, Councilor. We do have a couple guests that Dr. Wen has here today. A pediatrician, Dr. Tina Kumar. You wish to come up and testify here today? Welcome to the City Council Dew Burns Chambers.
Thank you, Councilman.
And
And thank
we're
you, Dr. Wen, for
Grateful to
having
hear
me
what you
here.
have to say.
So I am a pediatrician. My name is Tina Kumra, and I practice just down the street in Charles Village, part of Johns Hopkins Community Physicians at Wyman Park. And I have,
The hospital, not the university.
actually, it's a clinic that's part of Johns Hopkins,
hospital system.
the hospital system.
Yeah.
Exactly. I've dedicated my career to the health of children and teenagers, and I can tell you that there's no more effective tool, safer tool that we have than vaccines in promoting the health of our children. I know that families do have concerns, as you already eloquently pointed out, one that relates to autism, but also other concerns regarding side effects of vaccines, and have willfully chosen to delay vaccines or defer vaccines. And we have this conversation in our practices every day. I do know that it's our responsibility, as Dr. Wen pointed out, to share with families and reassure families regarding the overwhelming proof that we have that vaccines are not only effective, but they are safe. And that not only are we at a responsibility of protecting our own children, but also our communities and our vulnerable population. And so, as much as I understand as a parent myself, how important it is for us to make these decisions with care and with thought, that I encourage, not only have I vaccinated my own children, but I encourage all of the families that I take care of that, in fact, this is the right thing to do. I wanted to share a story with you all. There's a little boy that I take care of as a part of my practice. He's about 4 years old now. And mom came to me. She's highly educated, and she had fears about the vaccines that really stemmed from internet searches and also concerns from other parents. And she chose after long conversations, to defer the vaccines. And about 2 years ago, she had another child, and unfortunately, that child was very sick and was in the ICU, and for several weeks. She came to me for her first visit in the clinic with the new baby, and she said, what can I do to protect my child? And I said, vaccinate her brother, and make sure your vaccines are up to date as well. It is the one proactive thing that we can do that we know is safe and that will not only help those children that we're vaccinating, but also those vulnerable populations. And I think that really speaks to Dr. Nguyen's point of that community or herd immunization that we're trying to achieve right there in that home. So I do think that we as pediatricians and as a health system, as a political system in Maryland have done a great job in keeping our vaccination rates up, but it behooves us to use this opportunity to really promote the importance of vaccines at this point.
Doctor, if I can ask a question or two.
Yes, sir.
You mentioned when that young lady had the child that was very ill in ICU, and you mentioned that the best thing you can do for that child is to vaccinate the brother.
Exactly, because
Now, is there a age threshold where we should not vaccinate children? Is there a certain period of time that, is it, what's that threshold?
yes, so we start the typical vaccinations for measles, mumps, rubella in particular at 12 months. There is one vaccine that's safe enough to give at birth, and that's the hepatitis B vaccine that's typically given in the hospital. Outside of that, the first series of vaccines that's given is at 2 months of life. And just like Dr. Nguyen pointed out, I think it's also important to know that not only those, in this specific case, this baby was too young to get those vaccines, but also had a particular illness that prevented them from getting the vaccines. So this was more of a ongoing concern from this mom and from me about how to best protect this child.
Is make sure that no contact with anyone that's unvaccinated.
Exactly, and I'll be honest, I extended that conversation further with her. I not only said, make sure that her brother's vaccinated, make sure that family members are vaccinated, but make sure that those who really are primary caretakers of that child are vaccinated. Mm-hmm. So that means babysitters, that means daycare workers, that means, just like you noted, those that are in that same daycare setting or school setting. We want to make sure that that vaccination rate is as high as it possibly can be.
And one final question. You mentioned that the vaccine is MMR. It's for measles, mumps, and rubella.
That's right, Councilman.
We know what measles are after this hearing today, and I'm sure I had mumps when I was growing up too. I mean, I guess that was, we always had chicken pox, mumps. What is mumps?
Mumps is also a virus, and usually
And you contact the same way you contact measles?
Measles is actually more infectious than mumps is, but in fact it is transmitted by contact body fluids, and if lots of people remember it as the swollen cheeks, but yes, it's true that that mumps also has a lot of long-term sequelae or complications that are associated with it, and we are lucky enough to be able to combine it with the measles and the rubella vaccines, so that it's just one shot for the child.
And the rubella, give me a brief description of that illness. I don't believe I had that one.
Yes, so very similar. Fever and rash is associated with rubella. And, but again, I think that what's important within that combination vaccine to know is that the measles infection is actually the most highly contagious and the most infectious and the most invisible. But all three of them are important to
And the
vaccinate against.
same vaccine will be preventive against all three of those.
Yes,
Okay.
so it's that same shot, and then it's given at 12 months and then 4 to 6 years of age.
Okay, thank you,
Mr.
Doctor.
Chair.
Councilwoman Spector?
Doctor, you serve in the public health arena. Has there ever been an attempt to make the measles vaccine mandatory?
So the measles vaccine is mandatory in a stricter sense in Maryland, in that there is a religious exemption, that is true, and there's also a medical exemption. There are more lenient laws in other states. I believe California is one where you do not need neither a religious nor a medical exemption. You can have a personal belief that allows you not to vaccinate the child. So in the spectrum of requirements, actually, Maryland is able to accomplish high rates due to the fact that they don't allow that personal exemption, which is very different. It has to be either religious or medical. So I have families that do come to me and ask for a medical exemption, and it's not appropriate, and we have that discussion.
Thank you.
All right. Thank you, Doctor. And we now have Ms. Alexander Cumilia. Did I pronounce that right?
It's actually Kamala.
Kamala.
Yes,
Okay.
it's not
okay.
spelled like
That's why I
Kamala,
said Ms.
but
Alexander. I got that part easy.
I
Now, you are a
appreciate it.
parent.
I am
with
a
child
parent.
under 1 year old.
I am. I'm a brand
And what are
new
you
mom.
gonna? How are you gonna enlighten us, City Council, today?
Well, I'm here to speak as a brand new parent, and living in Baltimore City, to a little boy who is almost 4 months old. My child is beginning his vaccine series, as of the day that he was born, as well as he's received his 2-month vaccines. But I wanted to talk to you today about the reasons that my husband and I decided to get our child vaccinated.
Okay.
The first one is that we want to keep our child safe and healthy. And we're really interested in keeping our community safe as well, primarily because we're working parents. And we have to send our child to daycare, where we know
Well, it can
that,
be exposed to other children.
yes, he'll be playing with other children, so we don't want to be responsible for making other children sick. And we also want to participate in making sure that the environment that we know that our child will be in all day, every day, is safe because we've made the decision to vaccinate him. We also know that if we were to choose not to vaccinate him, there's a chance that he could become ill, and that would make it more difficult for us to not miss work. We need to be able to work in order to take care of our family. It provides the opportunity that our child Xavier will be able to play, to learn, to grow as a healthy child. And it really aligns with the personal values of our family, that we're able to protect not only our child, but also his friends and their families as part of a larger community. We've listened to the science and we've heard the evidence.
How did you find your information on vaccinations or measles? Did you go
Well,
on the internet?
We did not necessarily have to go to the internet. Right when you're in the hospital room and at GBMC, our pediatrician came in and explained what the series was going to look like. We were given the opportunity at
So
2
you had a
days.
reliable source of information.
We did.
Not to say the internet is not reliable, but sometimes it can be misconstrued and slanted to whatever position that.
Yeah, and we chose not to look at the internet. I think that if we had additional questions, we would probably have gone to reliable sources like the Centers for Disease Control, sites that, or the Baltimore City Health Department, sites that we are sure of the evidence. Of course, a lot of other things will pop up on our Google search, but we would likely look for more governmental organizations that have reliable evidence. So that's all I had to say.
Now, how old is your child now?
He's going to be 4 months years old.
So he
4
has
months
not been vaccinated yet.
well, not for MMR, because
MMR,
that starts at
for
12
that,
months,
yes.
but he
Yeah.
has been vaccinated for hepatitis B and other vaccines that are
Okay.
for children his age.
Okay.
Yes.
Okay. Thank you very much for taking your time to
Thank you.
speak to us
You're
this
welcome.
afternoon. Dr. Nguyen, did you have any closing point? Oh, Ms. Trueheart, did you wish to? Okay. Dr. Nguyen, did you wish to have any closing discussion on this? Council, any other questions?
No, I'm good. Thank you.
The only thing I wanted to add is just my thanks once again to the leadership of our city and our city council members and Chairman Curran for convening us today to speak about this really critical issue. It's one that, as we've talked through many of the issues, and we've heard that it is a complex one, but at the heart, it actually is a simple one. That ultimately, it's about protecting our children, it's about protecting our community, and it's about making sure that we safeguard the health and the well-being of our city. Thank you.
Well, for being on the job 25 hours officially, if you're sworn in, you've enlightened the city council, and hopefully through the media and also Charm TV, Channel 25, this will be replayed several times, so the true message can get out there, and the misinformation can stay misinformed and away from our folks. So I appreciate your time coming here to City Council chambers to enlighten us on this very important issue. With that, this concludes the hearing of the Health Committee of the Baltimore City Council.